don't know if my app got used every time I stored it up. The moment I restored it, it's such a new one. And I need to restore it again. Like over and over.
Yeah.
Yeah. For sure.
Sorry.
Yeah, oh, I do too. I call it Sean and whatever.
I leave mine. Yes, there you are. Alright, we're flowing, we're live.
I've given up, Charlie.
Welcome everyone to our committee meeting for Wednesday. Yes, December 3rd. Let's start off with the health service reading.
All right, good evening, everybody. We'll open up Health Services Committee meeting at 6:02 p.m. Before we go into our resolutions, we have three special guests here this evening, Brianna, James, and Lindsay. Who are going to tell us a little bit about their success stories in recovery. Guys would like to go up to the podium and tell us your story? Okay, I'm sorry. Don't be shy. Nobody here has bitten anybody yet.
All right. Hi, my name's Bree. I am 32 years old. As December 14th, I'll have 4 years clean and sober. I guess I'll start from like a little bit of like where I was to where I am now. So originally I'm from like Oneonta area, and life was not very good for me. It got to my rock bottom, I can say. I was an IV drug user, I was homeless, jails, institutions, and death. All of the three things I say that will happen for me. So I feel like the only thing really left for me was permanent death. Depression was a huge thing for me, mental health, and I guess these 4 years like changed my life. And I feel like I got on the Sublocade shot. Sorry, I'm like really nervous, but I got on the Sublocade shot, and that really helped me get a good start. I'm actually in the middle of coming off of that. I feel like I have a good stability right now. I'll say like this is like the first time in my entire life where I don't want to die. You know, like I'm happy, and I know what it's like to feel happy for once in my life. And I owe it all to like everything I've done in my sobriety. I go to meetings every single day. I have sponsees, I have a sponsor. I've come to the family planning clinic every month. So I have like a really good support system. I have a 10-year-old daughter who I lost in addiction, and like she's in my life. I'm like so close to get her back full time. Like everything for once in my life is amazing. Like I have a healthy relationship. I have a steady job. I have my own apartment. I just got my license for the first time ever. You know, like life is really good today. And I never thought I would be able to say that, you know, because like I was at that point in my life where I'm like, it can't get much worse and it will never get better, you know. But I know if I can do it, anyone can do it. So I think that's like it in a whole thing. I don't know what else to say really. But yeah, that's it. Thanks.
Congratulations.
Yeah.
Hi, my name is Lindsay. I'm 36. Been an addict since officially on opiates since 2016. I got into a severe car accident. I didn't even ask for them. My doctor offered them and then stuck me on them permanently. The MAT program with Greene County is the first program for me that actually worked. I've only been completely sober without any relapses, without messing up for only a year and 2 months. I'm a drug court fail, Twin Counties fail. Nothing seems to work for the situation that I had. And being able to go to Greene family planning and talking openly without a stigma of relapsing or having outside issues. They always have somebody there to talk to. I feel like the program really works as somebody who had failed multiple times prior. They don't, multiple chances become embarrassing or humiliating. You don't want to go back. You don't want to see people look at you a certain way. And I feel like programs like that are amazing and they make you feel comfortable and welcome. And I got to go skydiving this year because I wasn't an addict anymore. So being able to do those sort of activities now, whereas I wouldn't have dreamed of them before, is awesome.
Congratulations.
Hello, everybody. My name is James. Very similar. This is actually my fiance that was just up here. We started the program at the exact same time because we had both decided like, hey, the change has got to happen. Very similar to her. I was in a motorcycle accident when I was 18, and the doctors pretty much just hand you a giant bottle, and they were like, hey, have fun. And after a little while, you become dependent on them, and you end up needing it more than anything. Now, over the years, I was able to make it a couple of months sober, and then you'd fall back into it for a few months. Then you make it a couple of months again, and there's a very hard time finding something that actually works. Now, the meetings, although they do work for some people, for other people, they do not. I found that going to those meetings, I left more like anxious and wanting to make it go away after listening to all those depressing stories. So with the program like this, it was amazing. There was no stigmatism as to like, hey, if something happens and you use again, it's okay. We'll reset. We'll find something else that'll work for you. It's been a little over a year now that I've been 100% sober, no substances of any kind, and it's been amazing. 3 years ago, when we started here, I was barely making ends meet. We were driving a car that was honestly scary to take to the gas station. And since then, when we started this, I opened my own business. We both drive fairly new cars, and everything has been going extremely well. So this program in general, for me anyways, helped amazingly. There should be more programs like this. And I think especially with the way that we were treated, even if there was a relapse or we used at one point or another, there was no like fear of getting in trouble. It was a lot more laid back, and they help you to figure out what your triggers are and what they aren't, and what you can do to help progress that and do better in the future. Does anybody have any questions?
Do you still feel the desire to do drugs, to any of you, or
Sometimes.
at some point, I know some people, you said 4 years, that desire for it leaves you?
Can I speak on that?
Sure.
Okay, so I would be lying if I were to say like I don't have thoughts of using. Like I've been a drug addict like most of my life. Of course, I think about it, but the obsession to do it has left completely. Which also like I never understood when people would say that. Like when I started going to meetings and stuff, and people would say that, I never understood that. I'm like, I'm never gonna feel that. But I understand it. Just this past year, I'm like that urge and like impulse to just jump on it has completely left.
Okay.
Yeah, I agree with that. Like the thought never really goes away. I mean, without being somebody who's actually experienced it, it's hard to really get people to understand what that lifestyle is like. It's not even so much a want, like your body literally craves it.
Mm-hmm.
And without it, it'll throw you into all sorts of loops. So, I mean, I still have thoughts here and there, but things have gotten good enough now. And obviously I don't associate with those same types of people. So the thoughts are there, yes, but the ability and the real want to go and get something is gone for the most part.
It's great to hear.
For the three, what part, if any, has faith or anything played in this recovery journey?
As far as like,
Helping or anything like, is that even, is that part of the program involving faith or anything with it, or?
I'm not a religious person myself. I mean, I've always looked as if you want to be a good person, like you can be a good person. I mean, it's all about your life choices, obviously. Like, you know, my choice to use before was my choice, and my choice to stop was again my choice. So, I mean, I guess you have to get to a point where your want to do better supersedes the want to go and get that feel good for a couple hours.
Great to hear these stories, and, we're sitting here for public health, mental health, and sheriff's department all sitting here in the same room. And I think that's a big reason as to why things work a little bit differently in Greene County, at least I hope. Because they're continuously having meetings and groups who meet on how to best reach this population. So I'm glad to hear it's working.
And one thing I want to add too is I didn't get to a point where I was homeless living on the streets. Like I had a place to live, but it was still using the extra money that I had. Like my bills were always paid. I mean, I had a car, it was junk, but I mean, I had a car. You know, it's not always to where you're homeless, you have nothing, you're stealing. Like I always held a full-time job. I was always to work. I never skipped work because I was feeling sick one day. So
You're
like,
functional.
yeah, that's the thing is, you know, I was still able to function per se, but obviously that need before in order to do anything extra. I mean, yeah, I would need to go and get something, but it's not always super apparent. Like I know you see the people at the gas stations that are half asleep, barely standing. I mean, addiction doesn't always look like that. There's a lot of people that you pass on the street every single day that probably have a problem and just haven't gotten to a point where they're ready to make a change and do anything about it yet.
All three of you should be commended because it's a lot of hard work, and look where you are now.
Oh, of
compared to
course.
where you were.
And there's been many times that I had a couple of months where things were going great. I was like, hey, I'm done. Things are going awesome. All it takes is to walk into your normal convenience store you go to buy your coffee at and to see somebody that you haven't talked to in a couple of months. And it's no different than you see one of your friends and you go, hey, why don't we grab a drink on Friday and catch up? It's the same thing,
Yeah.
just with a substance that's not legal.
Just be proud of yourself because it's a hard road sometimes, and you guys have gotten through a lot of the hard work. And look what's on the other side, you know?
Almost
All
definitely. I'm
positive.
much happier to be on this side for sure.
Positive. So congratulations.
Thank you.
And that team will be there for you anytime.
Yeah, and they're absolutely amazing. Like, there's no stigmatism. I mean, if something was to happen tomorrow, I'd have no problem going, hey, this happened. I got a little screwed up. There is no like backlash to that. It's just, okay, what happened? What can we maybe do in the future to prevent this? They're super helpful and always very easy-minded about the entire process.
And who referred you to?
That's what I was gonna say. We live in Rensselaer County. We drive an hour and 15 minutes to get to family planning.
I don't
just
remember
for their
exactly how we got started.
We had a friend that was also in the program, Kelly,
Oh, okay, yeah.
and, they were the ones that said, hey, if you know, because we were obviously trying to detox ourselves and we were really sick. And so a friend had said, hey, if you call this number, they have an emergency service, like an over the phone thing, and they can get you in within, 24, 48 hours. I remember we had called on like a Thursday or a Friday, I think. And Monday morning, I was in their office and getting services so that I wouldn't be sick, and then getting onto a treatment plan that was set up specifically for me as a person because, even though we're together, we're two completely different people that have different needs medically, mentally, whatever. So I felt like it was really nice to build that up, to be able to talk open and say, hey, like, maybe I need some more counseling, or, you know, I need to go to meetings, or I need to have a therapist, or I need a little bit of a stronger dose than somebody else because I have, you know, whatever. So I feel like, I mean, we drive down once a month faithfully to their services, whereas in, obviously, Troy is only a 30-minute drive for us, much closer, but they don't offer the same comforting service that I have found with Greene Family Clinic, so.
Thank you very much.
Yeah. Congratulations.
Okay, well, appreciate it. Thank you.
News. I have good news.
You
I'll
have
only
good
take a
news?
second. Last time I gave you bad news and I got yelled at for it, so I'm gonna give you good news.
Can you just introduce yourself?
My name's Donna Julian. I'm the harm reduction coordinator for Greene County, also an RN in family planning. So right now in our MET program, we have 93 active individuals. In the month of November, we had 11 new people come to our program. In what you may not know is that there are different types of medication that people can be treated with. They can be treated with a film or a tablet that they put under their tongue. Most people are familiar with that. A new medication, they have 2 new medications that are injectables. Once a month you get this injection. There's no high, there's no low. It keeps people completely stable. And it's a very useful tool to use for someone who wants to eventually wean off because they don't go through withdrawal. And if they do, it's as very minor compared to if they were to do oral medication. So because of the success of the injectable medication, 40% of our patients are on injectable right now. We've had 247 people are inactive from our program. They have come through and they have left. Out of them, 13% of them completely weaned off of opiates and all substances. 42% of them were transferred to other programs. Either they moved or maybe they went to mental health because mental health provides services also. So it's kind of like, you're going to mental health, why go to 2 places if you can go to 1? The average time, which is kind of misleading, the average time a person spends with us is 1 year. But that's very misleading because some people that maybe are not ready for full recovery, they might come for a month or 2 and then leave us. But then we have other individuals that are with us for 72 months. I mean, I don't know how long you guys have been with us, 4 years. So that's why when you calculate it, it doesn't sound as impressive, but when you have people that are in recovery and they're with us and they're succeeding and they're doing so well and they've been with us for 4 years. Brianna told me she had 4 goals a year or 2 ago. 4 goals: get a license, get a car, get a job, get a home, get her kid. 5 goals. You got all of them, all right? I mean, that's wonderful. It's really wonderful. These 2 went skydiving. I mean, come on now. So there are a lot of success stories. There are a lot of professionals that come to our program. They're not the people that you would think. They don't look like the way that you would think they are. People get addicted to prescription medications from doctors way back when the doctors didn't think that it was harmful. And then, you know, there was a pressure on the opiates and the doctors cut them off and then people were left with no recourse. So, but good news, we have a good program and I hope you see that this evening. Thank you.
All right, thank you.
And thank you for being, be very proud of yourselves. Good job. Thank you.
Patty, I just got a quick question. On this program, is this a program you guys started yourselves, or is this something that you saw from the state and you guys are copying it, or?
I will answer because Laura is too modest. Laura Churchill came to me when I left the jail and went to family planning. In 2019, she said, Donna, we're gonna start a medication program. It's a Boxone program. And I said, you are crazy and you do not want to get involved in that. And Laura Churchill said, there is a need in the community. There are people out there, they need help, and we're going to start this. And that's how it started.
So then that leads into the next question is, you see three successful people here in this program working at it. Are you now a model? Are people coming to you guys to look at what yous are doing? Maybe be able to do that in their counties or wherever at all? Are you getting that?
I believe myself and Laura both go to conferences and things like that with a lot of other communities within New York State that have very small counties like we are, that are rural, that have the same issues that we have. Our patients don't have transportation, you know, which is a huge barrier for people to get treatment. Medicaid transport, it takes three days, and there's a lot of barriers when people live in communities like ours. So yeah.
Thank you.
And you're receiving state funding for
No, we bill insurance companies.
the insurance?
Yep, we scramble, figure it out. If you don't have insurance and you can't get your prescriptions, there's a program that will cover you for 2 weeks called Matters out of Albany. So there's lots of gaps that we fill, but you have to have insurance and we bill insurance. So just a little background, before 2018, only physicians could write for buprenorphine and other medications, even though nurse practitioners could prescribe as much opioids as you wanted. But in 2018, they changed the rules, and that's when the state of New York said, we need more prescribers for buprenorphine. That's when, you know, we're working with Jason and the Healing Studies, we started doing it. And in a new model in a DOH program versus a OSS or a mental health or other rules, you know, we were surprised. We figured we'd just do this a little while, and then the primary care docs would take over, but it did not happen. Primary care docs were not interested. They said, nope, you keep it. So here we are, we still have it. It's nothing I could have ever anticipated. But lots of people have been through, I mean, the success stories, the people that have just gone on to lead really happy lives. And it's because they had a chance at a place that met them where they were at and prescribed a medication that worked for them. So they weren't using substances that made them sicker.
Did you guys conduct follow-ups, like on a 1, 2, 3, like long-term? Just to,
After they leave the program,
Yeah.
we sometimes people call us. But
Yeah, I call them. A lot of people actually that have like left our program that have weaned. And I'd say, all right, well, I'm gonna call you. All right, and I'm gonna keep checking in on you until you tell me, Donna, leave me alone and stop messing with me. I'm getting on with my life. Some people, even after they wean, want to continue to come and see our providers. Just to know that somebody is checking in with them, and know that somebody is there, keeping them on the straight and narrow, as you will. And I think they find it reassuring, with our providers that they can do that, and we figure out a way for them to be able to come in and meet with the provider, whether they receive a prescription medication or whether they don't.
That little security blanket.
Yeah, and you know, sometimes, unfortunately, a lot of bridges get burned when a person's dealing with an opiate use disorder, and sometimes they have no one. You know what I mean? You don't have the family that you would normally have for support, or the siblings or the spouses and that kind of thing. You know, so it's good to know that you have somebody in your corner that, you know, that's there for you.
Thanks for giving us the chance to talk about it. I know you asked last time this came up about, you know, could we hear some success stories and some positives? So I appreciate you guys asking, and really appreciate you coming forward and the bravery it took to speak out loud. So really appreciate it, and thank you, Donna.
All right, into resolutions. First resolution, authorizing agreement for Greene County Mental Health Department with Arthur McGinn, MD.
Davis.
Davis, O'Connell, all in favor?
Aye.
Opposed? That's carried. Authorizing agreement, Greene County Mental Health with 24th Street Psychiatry PC.
True.
True?
Linger?
Linger? All in favor?
Aye.
Quick question. I mean, that's a big increase.
Right, yeah. What's happening is that, we have two psychiatrists that we contract with. One is Dr. McGinn and one is Dr. Corbin. This is Dr. Corbin. Dr. McGinn has been our medical director. For our license with Office of Mental Health, we need a medical director, who's an MD. Dr. McGinn is retiring, sometime before March 1st. And we were able to persuade, Dr. Corbin to come on to increase some hours. And he's actually taking on not only the medical director responsibilities, but also some others as well. So it is an increase. But I can also share that when I spoke to every other county clinic that I've spoken to the directors of, all of them are paying significantly more per hour than what Dr. Corbin will.
Thank you.
All in favor?
Aye.
Opposed?
Opposed.
Opposed? Rivera?
There.
Okay, that's carried. The Greene County Legislature attesting to the use of targeted inflationary increase, TII, funding by the Greene County Community Services Board.
Davis.
Davis? True? All in favor?
Aye.
Opposed? That's carried. Authorizing grant application, Greene County Public Health Department and New York State Department of Health, AIDS Institute, Division of HIV and Hepatitis Healthcare, Bureau of Hepatitis Healthcare and Epidemiology.
Davis.
Davis?
Leonard,
Lanudo? All in favor?
Aye.
Opposed? That's carried. Amend resolution number 306-25, authorizing contract, Greene County with Greene County Emergency Medical Systems, Inc. for the town of Halcott.
Davis.
True.
Davis? True? All in favor?
Aye.
Opposed? That is carried. Is there anything else to come before Health Services?
Motion to close.
Connell and Davis, we are closed.
Anya, I'd like to call County Resources Committee. We have a number of agenda items here to go through, but before we do that, we do have Stella, Create here to give us an update and share some insight as to what's going on.
Good evening, everyone. It's good to see all of you. So it's been a really busy fall for us. If you have we've moved. We've moved our administrative offices up the street. We're still based in Catskill. And this move was really motivated by or inspired by really connecting back to our mission and also thinking about the future. And you know, this partnership with Greene County Legislator is really core to our mission. And we have been, as you know, it's a very unpredictable funding landscape right now. And I know that that's across all sectors. But, you know, the arts are really feeling it. And this partnership that we have with the legislator, the programs that we're able to administer, I know, especially on a local level, to the organizations that receive the cultural fund and some of these other things that we've been able to do have really, it's just nice to be able to offer that kind of consistency. So thank you for that. So we've been, I guess, new to this year. We launched a kids program. The thinking behind it was how do we kind of fill in the gaps to after programming when school isn't in session. We worked in partnership with the Catskill Library as well as the Catskill Central School District. It's called Dance for All, and we provided workshops 4 days during spring break. And the Youth Bureau asked, how can we do more? So we're definitely going to be bringing that back, as well as We offered a monthly art club, that we hosted, at our space for kids. And what's really the way that I feel like, it might not be that obvious, but not everyone is a working artist full-time. And a lot of them, in a part of their kind of money-making portfolio, they are arts educators. And when we do programs and we're able to hire artists, we go to local artists first. And throughout the different things that we've been able to do through our youth programs, as well as the re-grant programs that we administer, it's dozens of artists that are locally living here, and then they're able to, bring that money back into the community, which is really great. Really excited to report that we've launched our Greene County Poet Laureate program. Thank you, Sharon True, who's been really, it's been really great working with her on this. And we've identified, we worked with the local panel, and we do have somebody that has been nominated to the county administrator. So we're looking to announce that at the end of the year, once that's confirmed. We had 11 nomination applications and 8 individual applications from poets around Greene County. If you're curious, there are poets around. They are around. And I don't have it in front of me, but it was kind of an interesting, it wasn't just in Catskill or just in one area. They're really from all over the place. And some people we knew, some people we didn't. And it was a real bit of an age range as well. So that's a 2-year term. That was just really exciting to be able to start, and look forward to sharing more with you. So the Arts Council will be working with the Poet Laureate to do, basically help them create their own programming in terms of what their focuses are. We'll let them set those priorities, and there are some events, and we're gonna work with them to print a broadside as a part of their term. So more to report on that as that comes to fruition. Let's see. So with the move, we are a really small team right now, and the organization has been around for 50 years, and it's evolved a lot in the last 50 years. And so when we're thinking about the future, it takes a lot of energy to bring people to your own space, and with a wide service area, we thought it made more sense to bring the arts to where people are. And so that's really the motivation behind the building sale that just happened. And what's exciting about that is 3 local artists, working artists, purchased the building. So it will continue to be an art space for their own practices, studio practices, as well as the first floor, I think, will maintain some sort of a gallery presence. So that's really exciting, that it will continue to have art activities there. And I guess in terms of what we've been doing, we just moved in September, but we have our first gallery pop-up. It opened a couple weeks ago, and it's up through the winter solstice. We are at 393 Main Street, and that's the Catskill studio for WGXC, our community radio station. And they had some unutilized space, and so we have about 55 Create members that are showing art there. And we're based, and earlier today, our grants coordinator hosted a workshop around building budgets at Bridge Street Theater. So, we're already starting to try to utilize spaces that exist that aren't being used, filling in the gaps essentially. So it also gives us an opportunity to introduce people to these other venues that, if you've never been to Bridge Street, it brings awareness to spaces that some cross promotion. So I mentioned the funding landscape is very unpredictable right now, and we're really in a place where we're looking to grow. We're working on, at the beginning of the year, we're gonna start, our next strategic plan. Last week, we just, put out a job posting for a community engagement coordinator. And so that's really to deepen our outreach and partnerships and help us do the work of trying to identify more locations across the county to be able to do not just gallery programming, but also workshops and perhaps more in performing arts and also networking events and things like that. So it would be really helpful to be restored in the level of funding that we had previously. We've been able to do a lot with our small team. So we're really looking forward to grow and basically be more visible. Anyone have any questions?
Stella, do you guys have anything planned for the Rev 250 celebration next year as far as like working with some of the local artists to showcase any work or anything related to the anniversary?
Nothing specific. I've had some conversations throughout the year just to kind of see what kind of interest there was or if there's anything already happening. But yeah, I guess I can say we've been working on it, just is through conversation at the moment, but nothing specifically planned right now.
Anyone else for Stella?
No, I think you've actually grown the program by leaps and bounds from where we were 4 years ago, 3 years ago.
Thank you.
Much more stable.
Yeah. Well, oh, and I should mention, I know that Columbia County, I think they're finalizing their budget, but I've been told that we are receiving an increase, which is great too. Because we've been working really hard on making sure that we're getting support from the different counties that we serve. So I did want to let you know that as well.
Did you get anything from Schoharie County?
Not yet. We're still working on it.
You gotta get a hold of Chris, huh?
Yeah, exactly.
Yeah, if you have any intros, I could,
It's good to hear that you had some nominations for your poet laureate, so.
yeah.
Not bad.
Yeah, we
Nominated Charlie.
Second. Thank you, Stella. Okay. Move on to our action items here. We have, like I said.
Mike, before you do that,
Sure.
the historian, do we hear any more about the 250?
He's supposed to be coming in January to give us concrete things, and I know he's gotta meet with that committee they put in. So, that hasn't happened yet.
No, there's been no meeting of
No,
that.
and no meeting yet. So
We're gonna miss vote.
maybe we've gotta try to take the bull by the horns here and push some things forward.
Yeah, okay, thank you.
Might be what we want to.
We're running out of
We don't
time.
have to.
Right,
Okay,
maybe
so
we're gonna
nothing-
have to
nothing
figure
will
out
happen.
what we want and then have him go with it.
Yeah. The one thing I thought of that, I thought would be great is they have all the reenactment people and stuff. We
Absolutely.
could have had a parade, that went down to the point, and then reenacted, all set up in the park down there next to the river. That'd been fantastic.
I know the American Legion, post in Catskill is working with the other Legion posts, and they are planning a parade down Main Street to the historic Catskill Park.
Oh, good.
Right.
Thank
I
you.
have a feeling this might be like a couple week type of celebration because so many towns are gonna be doing parades. You kinda, it would be nice to coordinate it so it's just like a nonstop celebration for, that period of time. Whether it's a week or two around the, 450th anniversary.
Everybody pick a weekend and.
Yeah. Yeah. So.
Okay.
Okay, we got number one, authorizing the public hearing for our agricultural district 124 and declaring lead agency status 2025 annual review. The motion, Dorrington,
True.
True. I know James. What do we have for people who are asked to be included into it? Any?
So the month of November was wrapped up. We had 7 applications, 1 withdrew, 6 active.
6 active, okay.
Just more than, I think, last year report.
And when's your final review there? When's that? December?
We're gonna have the AFPB is due the night of the Economic Development Committee meeting, which is the 15th.
15th, okay.
So we'll be lined up to do this public hearing in January, and that night we'll have a recommendation for inclusion.
Good.
So we're on track.
Anybody questions on that for James? All right, all in favor? Aye. Opposed, so carried. Second, authorizing agreement between Greene County and the Columbia Green Community College Foundation and authorizing payment.
Rivera.
Who do we have?
Rivera.
Rivera, second, Lucas. Any discussion on that? All in favor?
Aye.
Opposed? So carried. 3, authorizing agreement, Greene County Agricultural Society. I'll take that motion.
I'll second.
Dorrington seconds. Any discussion on that one? All in favor?
Aye.
Opposed? So carried. 4, authorizing agreement, community action of Greene County. Any motion on that?
True. I'll second.
Second by Dorrington. Any
Do
discussion?
we know if this is an increase from
It's a $50,000 increase.
$50,000 increase? I mean, are they presenting to us their
They've
budget?
never presented to us.
I think it's time.
Right.
I think it's time for them to present.
I mean, why the increase? You know, how do we explain that to people? You know, what is it going
Table
for?
this? Is it critical that they give this funding, for this cycle for December?
They figure they're gonna get a lot of the overflow from downstairs. They start changing. They only get 50.
And who's our contact at Community Action? Who? You're the contact?
Jay goes there.
Thanks to Matt.
What are you telling me?
Thanks to Matt.
What are you telling us?
Supposed to be me, but I
Should
delegated
give
that
them
to.
another $50,000?
Yes, I did. I'm the one who told him to ask for it.
Oh, man, ask for it?
That place is about to fold.
I think it would be important to have them come in and present.
We can do that, yeah.
What would you like? Nah, I mean,
No, I'll
we
say,
could
I'll-
table this.
No,
And then have them come in
Jay
January.
says that that's what it's supposed to be.
Well, Jake, if you could pass the word to
Oh, it's
Joseph in
gonna come down.
January. Right, so Joe, tell us what they'll be doing with that extra 50,000.
And
No, but
Putting up more vending
they
machines
just have the big flow coming up there next.
And my worries is changes don't come and they end up with a fixed 50.
Right.
Are you gonna
They
pull
need
it back?
fencing and stuff like that.
we'll see, you know, once you start and you can't turn off the faucet.
Well, there's some truth to that, for sure, Matt. So, all right.
We can buy them tents.
That's true.
All right, all in favor? Aye. Opposed?
Yes.
Recuse.
Yeah, recusal, abstain.
Thanks, man.
Sorry, Jay.
All right, 5, authorizing agreement Cornell Cooperative Extension Association with Columbia Green Counties.
Lavera.
True and Lavera. Any discussion on this one? All in favor?
Aye.
Opposed, so carried. Authorizing agreement, create Council on the Arts.
True.
True. I'll second that. Any discussion on that one? All in favor?
Aye.
Opposed, so carried. Authorizing Greene County Cultural Fund contracts. I need a motion on that. Lavera,
Lavera.
second. Dorrington.
Can we just make sure that we get a list of, what they were? I know, like Kay used to invite us to when they would award the contracts out, so we at least knew who was getting the funds and what the projects were.
We'll send a report, and, yeah, it's a little hairy this year,
Yeah.
Yeah,
Trying to get it
timing-wise.
together.
yeah, but we did it.
Yes. Thank you.
For sure.
All in favor on that?
Aye.
Aye, opposed, so carried. It's authorizing agreement for the Greene County Federation of Sportsmen, and I'll take that motion.
Second.
Second by Lucas, any discussion? All in favor?
Aye.
Opposed, so carried. Authorizing agreement Historical Society. Motion on that?
Dorrington.
Dorrington, second.
Linger.
Linger? Any discussion on that one? All in favor? Aye. Opposed, so carried. Next one is authorizing agreement between Greene County and the Mountaintop Historical Society. Before we go into this, I just have, why are we only giving 5,000 to Greene County Historical Society with 15,000 to the Mountaintop Historical Society?
Right, and I thought last year that was a one-time thing we gave them.
I thought it was too, but
For the parking lot.
Right, I thought it was a one-time.
I want to say it had something to do with,
I thought they used that money last year to improve the parking areas or something.
there was parking last year, but I think it was bathrooms this year.
No,
It was separate.
not bathrooms, it was, the first one was to develop the project for the parking, and then this is actually going towards the lot itself.
But this says annual general support, doesn't say anything about that. I just feel it's like, we're slighting the Greene County Historical Society by.
Well, that was my point too. I mean,
Well, the amount of visitors that go up to the Mountaintop Historical Society is phenomenal. And the amount of business that brings into the county itself, as far as, people spending money in the county is unbelievable as well. So they do a lot up there. There's a lot of people coming. I mean, that's just like the Bronick House. Bronick House, they came and asked for money. We gave it to them because we understand as a community that, we're bringing people into our community, they're spending money.
Well, maybe they should
It's
come
money
down
well
here and
spent.
explain why they need another $15,000.
Seems sort of like Matt said with the other thing, once you turn that faucet on, there's no
Yeah.
turning it off. Last year, we agreed to do more than we had the prior year. We thought that was kind of a one-shot deal. And now here we are this year, and now they're asking for the same amount.
Just a blanket.
Yeah,
And I believe last year when they came, that it was gonna be more than that.
Yeah, I think so.
That was already told, that was a letter. It was not a one-shot deal. My argument. Broncos community.
At parking area, by the house and the bathrooms in there. No, there's a
I guess
process.
it's to
Right.
affect
It wasn't
them
one
to
year.
get less funding, because I think, but Greene County Historical Society did get some Greene County Cultural Fund, like the corporate fund. So I do want to mention that. I don't
Yeah, I
want you to
remember
get.
actually, that was one of the texts that we had to write a couple of years back when Greene was having it.
Daryl's right, though. You go by that parking lot on a Saturday, it is filled right
Yeah.
up.
Yeah.
And I don't mean 20 cars, these are hundreds.
well, I can understand certainly with you say expanding parking, but they're going to visit the halls and everything. They're not necessarily going to.
Actually, I will tell you,
Eat at restaurants, some of them are doing Airbnb.
when they,
taking
when,
initiative
no, no,
with,
when they went to that parking lot, the people that run the parking lot. And, Larry Gardner, I was talking to him, that they hand out, the Greene County promotional things that tells people where to go out to county. There's restaurants and stuff. They handed out so many of those things, they had to run down the next day and get 5, 6 more boxes of these brochures to hand out. They are promoting Greene County phenomenally. And this is, they face to face, they come, they hand it to them, they talk to them, people appreciate it. If you ever look for something to do on a Saturday or Sunday, just go up there and spend 5 minutes and watch what happens. Because you will be astounded at the amount of press the county gets from that parking lot and what those volunteers do up there for us as a whole.
Any more discussion on that?
I found the letter. It says the letter formally requests the Greene County Legislature includes funding in the amount of $25,000 in its budget for the purposes of enhancing the Mountaintop Historical Society's role in supporting Greene County tourism. And then we agreed to give them 15 instead of 25. Nothing about a yearly $15,000. I just feel like they should come here and explain why.
We can have them.
$15,000
Have someone come down there. No.
You know, just like the Greene County Historical Society came and explained why they needed funding for their project.
Right. We can arrange that.
But I think this was a multi-year plan, that they were doing step by step by step, a little bit at a time. It wasn't.
That's not what I had in my notes last year. I had found a letter.
I just don't want them to become dependent on this
Correct.
amount of money every single year and
Right.
get comfortable with that every
Just like
year.
we don't want the Greene County Historical Society to, want this. Again, it's that faucet turns on and then hard to then turn it off.
All right. You can vote on this then.
You didn't work yet.
Motion then? I need a motion then.
I will.
Linger, seconded by Thornton. Any other discussion? All in favor? Aye. Opposed?
Opposed. They need to come
We
down
have
and
one
present to us.
opposition. Rivera? So carried. Number 11, authorizing Greene County Libraries Association. Need a motion on that one.
Motion.
Lucas, second.
Torrington?
Dorrington. Any discussion on this one? All in favor? Opposed? So carried. Authorizing agreement, Soil and Water Conservation District. Need a motion on this one. Linger, I'll second it. Any discussion? All in favor?
Aye.
Opposed, so carried. Next one is authorizing agreement, Soil and Water Conservation, this watershed, assistance program known as WAP, or WAP. Okay, WAP. The same. Linger. Dorrington. Discussion on this one.
Aye.
All in favor?
Aye.
Opposed, so carries. Report reappointing our historian. Need a motion on this? True, second. Rivera, all in favor? Aye, opposed, so carried. Number 15, reappointing members to the Board of Directors of the Soil and Conservation District. Legislative rep and our alternate. Rivera, second. Lucas? Any discussion? All in favor? Aye. No, sorry, abstain. Abstain. Any noes? Yeah. Okay, we had 2 abstentions and the rest were yeas. See, that passes. Okay. Number 16 is reappointing members to the Fish and Wildlife Management Board. Dorrington, I'll second that. Any discussion on those? All in favor? Aye. Opposed? So carried. Anything else come before county resources?
Just a note on number 7, authorizing Greene County Cultural Fund contracts. There was a typo in there with council. I don't know if
I
that's.
saw it spelled
All right.
council.
We should probably fix that.
Okay.
There's a typo of council.
Thank you, teacher.
You found it yesterday? Well, I had a snow day yesterday.
found it
so
yesterday?
maybe that all the time.
I was on the found, he found it all the time, brought the
I
notes
had
and
a day
everything.
off yesterday.
2 hours today.
2 hours today. I had extra time to read through these things.
Oh, I love it. Anything else besides Rivera?
Motion to close.
Motion to close by Thorrington, second by Drew. We are closed.
Thanks, Bill.
Nice, Stella.
Thanks, Tom. Good night.
You lost control, right?
Yeah, you did.
Another fine, yes, you gotta say.
WAP.
Waited. That was very close. My dad would have been proud of me. Mary's not, right? Well, you're so right.
I almost took offense.
Right. James, it should do anything. He can.
Yeah, Jim wants to leave it. Oh, yes, he does, but so is Jim. He's right.
Yeah.
Actually, Jim and Daryl. Bingo.
So,
Okay, with the open up public safety committee at 6:56. And we will start. Tomorrow.
Wow.
First line, for the sheriff.
Good evening, everybody. The November, numbers are as follows. EMS calls 575, fire calls 160, police calls 1,564. The unknown 560, for a total calls of 2,859. The 911 admin and emergency calls came to 3,147. Text 911 calls were 30. The mutual aid for EMS was 42. Fire mutual aid was 5. Hazmat team had a standby in their quarters for the Hunter Fire Department. And tonight you have one resolution. That is a grant that we received around, I think it was $24,000 for the purchase of a message board for emergency service department. And I believe that came to roughly 19,000 some change, and I believe there's $4,200 left over, and we'll have to reconsider with the rules of the Homeland Security on that particular grant where we can spend that money on. So on other topics, as you know, I'll be coming before you next month to take our Twin Clove Technical Rescue Team to make it a countywide team. Next month, I do have a meeting Thursday morning with the fire coordinator out of Ulster. As you remember, Centerville and the city of Kingston, our Centerville is part of Greene County team because of the fact of the grants and so forth. We're both going to be sitting down talking about procedures and so forth. Once they are taken care of next Thursday, personnel level, we're ready to go. We have 56 members. That's all broken down in different skills on that team. And both of the teams, the technical rescue team and Ulster, they practice once a month, every month, and it's quite an organization. Effective the first of the year, one of my fire deputies, and we have a meeting next Thursday, will be overseeing that county team to support it and also to respond out to calls. Next Monday night, I will be honoring, along with the state fire instructors, firefighters who just completed the interior firefighting operations, which is a 50-hour course. These firefighters just completed 79 hours prior for the BFO class. So and basically these 50 hours are basically teaching them how to physically active with fire suppression and rescue inside of a burning building. And so far, it looks like we have about 40 of the family members coming as well. One thing I mentioned in September's meeting was that all the state fire instructors of Greene County and Columbia were going to meet in the middle of October to try to work together to increase training in both counties. And they did meet over in Columbia County Training Center. One thing about firefighters, we don't like change. But I have to say that particular day was on a Sunday morning. I have to say that fire training in this county is going to increase. The first quarter of 2026, we have 10 major training programs that are already out there advertised. And in the month of April, May, and June, the training facility, both the classrooms and our training location will be filled probably at least 3-4 nights a week. The training that they're planning on bringing in. So I'm looking forward to that. And one thing that we'll be pushing is getting out in the field, going to meetings, making sure that all the fire chiefs are aware of what's going on so they can get their new members or whoever and so forth. And the last thing that I have is, and I love on December 16th, the fire science class from Quest Guard 3 from Greenport will be coming over to our facility for a 3-hour program. They're going to go through the 911 center, the training grounds, and also to go through what we do as a hazmat team. This class this year is 10 students, which are the leadership of Greg Fox. So little by little, I think we have 5 of the 10 that are firefighters. I think 2 weren't firefighters, and we made a couple of connections. One was in Earlton Fire Department, and I can't think where the other gentleman was. But so I'm looking forward to that day because it's really nice to see that next generation start moving forward to hopefully take over 20 years from now. Other than that, Sean, you got anything on EMS?
Nope, no questions or concerns from any of the administrators throughout the county as far as any significant changes. So we'll get them to sign off on all the updated plans.
Okay. And the last thing, I always bring it up, was if it wasn't for the volunteer firefighters, you listen to the radio, the past 4 weeks, especially in the town of Carroll, Greenville, I'll say New Baltimore, it's been.
Heating season is upon us.
You know, people just, I just don't understand, how, these major fires happen, but they do. And I can't say enough for our volunteers. And, of course, our EMS too, I can't, they're right there as well with paramedics. So, any questions?
Just, oh, go ahead.
Go ahead, I'll go after you.
I just wanted to ask about, this EMS things that are going on. I'm hearing word on the street is that Greene County has asked Greene EMS to purchase an ambulance.
I don't know.
Well, I was told you were the one that asked them.
I did.
You and Sean.
I didn't ask anybody. Okay. But I can tell you, I did talk to Sean, and I did know that Catskill and Wyndham both said that they were not able to provide it. That was the last I did. I didn't hear anything about creating.
I was told that nobody even spoke to Catskill. That was before Thanksgiving.
Before Thanksgiving, I was told that they said no.
Who's the point of contact that Castle that you talked to?
I don't know.
So nobody in the county has approached Greene EMS about purchasing an ambulance.
I don't know. Nobody in the county did. I did not.
I heard the same thing you did.
Oh, that's why, I mean, I'm tired of hearing rumors. It's gotta be out here with the public, so let's straighten that out and clarify that if we could. Sean, you're our EMS coordinator. If you could straighten that out and find that out.
Yeah, I'll try to see what I can find out on the street or whatever. As far as I'm aware, I don't think that Catskill or Wyndham was approached.
Okay.
I'll try to confirm
If you
that.
could confirm that for us, that would be true.
I
Sooner
would
than
not be in
later.
favor.
What's that?
I would not be in favor.
Green.
No, I mean, I just don't know where it came from because that wasn't part of the discussion that we had talked about.
Yeah, I thought it was Catskill gonna get one, Wyndham gonna get one, or whatever, and go from there, and expand from that service.
Right, we were not looking to increase any more payments that we don't really have to expend, you know, if we can piggyback off of an organization that already has something, you know, and just go that route, that might save us a little bit of money.
And I would
But
think
also
it's-
provide us the service that we're looking for.
I would think a decision like that would go through the entire board, not just through the county, you know, arbitrarily. I think we should all vote on that.
So tomorrow, Sean,
Yeah,
just make a phone call.
Yeah, so
Thank you.
figure out.
Yeah. I think-
Send me an email and send it to the chair. All of
Do that,
all of us.
we have number.
Thank you. Mike, you're up.
Mr. Chairman, over the past couple of years, and most recently the early fall, there's been an interest in our county by outside companies to bring in these battery energy storage systems. If it's okay with you, if we can have the director, maybe next committee meeting, have somebody come in to discuss what the impact of those facilities would be on our community. That way we can,
Sorry, we actually had this.
That's 2 years ago?
A couple of years ago.
Yeah, it was last year.
It
was last year.
What's going on with property? Yeah.
What I should do, Mr. Chairman, is I know, there's been a lot of changes and updates, from talking to the Office of Fire Prevention and Control. I could, make a phone call, see if we can make that happen. I'm not sure if that would be in January, but I would try to make it as soon as possible.
yeah, if that's okay, to have them speak.
It'd be okay, but unfortunately, the ears this needs to fall on our town boards and planning boards, because this is with them, where the town.
Right, but we have a much larger forum of an audience where everybody in those towns can see the presentation as
Yeah.
opposed to individuals.
Was there something that a county could put a moratorium on that? Didn't you?
I don't know.
send us that, or-
Yeah.
I have no
I
idea.
thought you sent us something.
That's something that
We used it.
perhaps our county attorney can do.
Towns can.
Sounds cool.
Actually, years ago, the town of Hunter, this was back when I was still a supervisor. They came to us and we were moratorium on, passed a law against it. And then when they tried to do the post property down here, I actually came down to the meeting for the PERCAT scale, and, I explained to them our feelings on it, and they ended up not pushing it through as well. It's pretty dangerous.
Well, I just think it's a good reminder because according to the IDA minutes, in September, there was an organization that was looking to put one on Bailey Street in Coxsackie.
Right.
And then it got pulled in their October minutes. It might be a good reminder just for everybody, this technology changes.
Yeah.
Maybe it's good. I don't know, but we can just have a discussion about that. I'm not saying that it is, but
It's not.
They just had, it was down in Long Island, I think last month, and I just wasn't able to, attend it. But they had invited, county officials like fire coordinators and director of emergency management and so forth to go down, and I think it was in Nassau, Suffolk County, to go through this particular power plant and look at all the positive and negatives and so forth. And I haven't seen the report out on that yet, but it'd be interesting to see what comes out on that as well. But I'll work on that tomorrow.
thank you. I appreciate it.
The other thing you should remember is that all these projects that they wanna put in our county has absolutely zero ability to service our constituents. It always goes somewhere else, and the reason it's here is because they don't want it in their backyard.
No, I agree with you.
We have a lot of poor landowners.
I agree with you.
And so Greene County's getting hit hard with this.
Right. And it does nothing for us at all.
No.
Zero.
We have the forum where we can have someone come in to talk about it, to reach a much larger audience instead of having that one expert go to individual towns. I think we should take advantage of our platform.
And you had sent us the thing from Ulster County. I knew you sent something to us. Ulster County Battery Energy Storage Systems Notification Law that Ulster County was trying to push. That would require towns and municipalities that approve BESS projects, which is the battery, to provide immediate written notification to the Ulster County Department of Emergency Services. This law will ensure that county emergency management officials are aware of any such facilities can take proactive steps to protect residents of first responders.
Yeah, that came out of the Republic Club.
There's actually a science journal too, you know, when you talk about chemical engineering, a science journal that gives you all the data on those things that might be available to you. So I remember a couple of years ago when they were looking at the junkyard, location. I looked into that. That's available.
Okay. Anything else? Thank you very much. Oh, sure.
Saving the best for last.
Yeah, sure.
Commissioner.
Hi, good evening, everybody. So, for last month, we had 107 civil attempts, served 77 civil papers, issued 113 traffic tickets, investigated 32 traffic accidents, made 46 arrests and 4 DWI arrests. We handled 506 calls for service and made 375 traffic stops. On November 1st, the starting jail population was 36. As of November 30th, it was 29. The high for the month being 36. Corrections officers did 38 transports, traveling 1,449 miles, totaling 141 hours, moving 38 inmates. And we have 2 state-ready inmates in our custody. It was a very challenging month. We not only handled the case where we lost Tammy, we also lost one of our special patrol officers, Rudy Pavlin, who put in many hours protecting this building. On a positive note, though, we were contacted by the Town of Carroll Police Department who asked us to assume control of a missing persons case. The initial reports by the family were inconsistent with the information that was developed by investigators, and this led our criminal investigations unit into obtaining and executing several search warrants. As a result, we located and recovered the remains of the missing subject who had been murdered and concealed on his property. So far, we've charged the son and the victim's granddaughter's boyfriend with murder in the 2nd degree, conspiracy 2nd degree, tampering with physical evidence, and concealment of the human corpse. Additionally, we charged the son's wife with tampering with physical evidence and conspiracy in the 6th degree. Both of the male subjects were committed to our jail with no bail, and the female was released to appear on a later date. It was a huge case, and I'm very proud of all the deputies who worked on it. One last thing, I have to commend John and his dispatchers. Yesterday was an extremely busy day during that snowstorm. I listened to that radio all day, and I have to recognize those dispatchers for their efforts. They efficiently dispatched over 100 calls during that snowstorm. I believe it was 113 according to the CAD that I looked up. It was nonstop all day, not only for them, but for fire and EMS as well. At one point, Deputy Storm Benjamin, now Storm McGinnis, was dispatched to a structure fire in Lexington, where she ended up on the hose line, assisting the Lexington Fire Department. While there, the 911 center received a report of a woman who was unconscious and unresponsive at a house approximately 6.5 miles away. While taking other calls, the dispatchers were actually giving CPR instructions over the phone. Due to the road conditions and the other EMS units being tied up, Deputy McGinnis left the structure fire and got to the location of the medical call, where she applied an AED and took over CPR and administered other life-saving efforts until the EMS arrived and were able to establish that the victim's heartbeat was restored. She was then transported to the hospital, and this is just a great example how all of our emergency services working together in terrible conditions saved her life. So thank you, and please pass that on to them.
Certainly will.
Oh, yeah. Question?
Go ahead.
Sheriff, what's going on with the state troopers here at the Catskill Barracks? Now, they don't receive calls there, or?
They don't, all the calls are routed to SP Middletown, and they are being dispatched from Middletown. A lot of times those dispatchers don't know the way things work in Greene County, to put it in a very blunt way.
What's the reason? Is this a cost savings?
Yeah, this has been statewide for several years.
There's counties that they did it with.
Yeah, Dutchess County, or K-Troop, basically. So those 5 counties across the river, Dutchess, Putnam, Westchester, they did this probably 15 years ago. There was only 2 stations left in the whole state. That was Catskill and Highland, that had dispatchers. And, they just want to do troop-wide traffic management. Albany's they moved that into headquarters probably even longer ago than K. So it was for them, it was long overdue. You know, it definitely is impacting our citizens. We're probably picking up more, but I haven't checked the data, but I'm assuming we're picking up much more 911. And the bottom line is they want everybody to call 911 anyway, and they should be. The people that were using 622-8600 were generally the older citizens who still had a phone on the wall. you know, and we've come a long way since then, but, they are still taking calls, they're still dispatching through there. I mean, sometimes, if you listen to the radio, it's a little, you know, they'll send troopers to, you know, places they have, you know, they'll send them everywhere. They're sending them to the village a lot, actually. But, yeah, unfortunately, that, it impacted us.
Something out of the norm or.
No, that's the way they've been. They were just on the shoestring, but they were left. I don't think there's been a civilian dispatcher in Catskill since Terry Joe Gallagher retired in, 5 years ago. So and those troopers rotate in and out of there, and they're not familiar with the area so much, so, you know, I don't know if the quality of the call really is gonna change much. They'll still, you know, they'll still get sent. I mean, if you call that number, you'll get a dispatcher and they'll send somebody. It might be somebody who has no idea where they're sending somebody. But,
Even on that same move, and where John said, everybody listens to the radio, there was a comment that I heard last week on an SP unit that was heading to Middletown for process. Are they processing arrests in Middletown?
no.
Okay.
Now a lot of times you'll hear, now that they're all on that frequency, so you're hearing Highland cars and, you know, cars in different zones.
It could be.
Yeah.
I heard it, I'm like, they're taking only people from Middletown to process.
No, they still process at Cooksaki and at Catskill. Hunter, I think they still process there. They changed the office a little bit, they shrunk that as well. I think they're down to one trooper there, right? Two maybe.
I don't know, there's an awful lot of troopers in town hard.
They're on the post, but they're not assigned to the satellite. There used to be 7 troopers, satellite, I think they're 2 now. And they're changing.
So Sheriff, first of all, I want to commend you and your office on apprehending the suspects in that murder in Carroll. I find it ridiculous that the accomplice was ROR'd, but that's the infinite wisdom of the politicians in Albany, right, with no bail. But in saying that, my next question probably may seem trivial to some, but is it still illegal to smoke marijuana in public?
Technically, yes.
Okay. Is it standard practice to enforce that law?
Would be discretionary upon the officer, I guess. If you're asking about us.
I'm just saying in general.
In general, it's discretionary. If it's somebody blatantly or it's a complaint, then it should be enforced.
Right, because I'm getting numerous complaints from the public as well as witnessing it myself. I can only speak to the village Catskill, especially during the parade of lights where there's people smoking marijuana on the floats, walking down the streets, open containers.
Wow.
And on the streets, and then also employees smoking marijuana in public at Price Chopper and Walmart and other places like that. So I didn't know if maybe the penal law changed where it was legal now to smoke marijuana in public.
Unless they changed it very recently.
As well as, you know, it's still illegal to drive and smoke marijuana, correct?
Correct.
Okay, so maybe just a reminder to the general public that it's still against the law, because it seems to be pretty rampant around our community.
Yeah, I participated in that parade and I did notice the smell. I didn't see anybody, but I certainly smelled it like I'm sure everybody else did.
Thanks, I just wanted to clarify, to make sure that, you know, I wasn't going crazy.
Kids for them.
I wasn't going on your float, was it, Matt?
Wasn't on our.
Bathroom on that
Stuck
floor?
at Dutch and Atlantic for an hour and a half.
It was pretty cold. So.
Thank you.
For 40 kids.
Anybody else?
Thank you.
Thank you.
Thank you.
Okay, moving on to closed action items, number 1, approving the purchase of 1 variable message board with emergency services. Department. Hens. Lavera. Vera. All in favor?
Aye.
Opposed? That's carried. Number 2, amending resolution number 488-24, appointing members to Greene County Fire Advisory Board.
Davis.
Linger.
Davis, Linger, all in favor?
Aye.
Opposed? It's carried. Number 3, budget amendment, insurance recovery, Greene County Sheriff.
Davis.
Martinez.
Davis and Martinez,
Martinez, Davis,
all in favor?
Aye.
Aye. Opposed? That's carried. Number 4, budget amendment, insurance recovery, Greene County Sheriff.
Davis.
Thornton, second. All in favor?
Aye.
Opposed? That's carried. Anything else to bring under Public Safety Committee?
Motion to adjourn.
Motion by Handle,
Second.